Hi, my name is Shannon Lynch, and I did my research paper on why women are electing to get mammograms. Mammograms can detect breast cancer early and are used as a tool to do just this. Breast cancer is the leading cancer-causing death among women, killing about 40,000 women in the United States every year. An estimated 28 million women have mammograms annually. They do not prevent the disease. Nevertheless, it is known as a life-saving test. It has the potential to detect breast cancer in its early stages so that the disease has a better chance of being treated. 4 to 10% of women's mammograms are found to have some kind of abnormality, resulting in the need for subsequent testing and screening. 80 to 95% of these abnormalities turn out not to be cancer. Women are not going for mammograms as often as they should. Some are not even going to get these essential tests at all. There are a number of possible reasons as to why women do not go for mammograms as often as they should. A 2004 Institute of Medicine reported that some reasons were that women find the procedure painful, some women fear a breast cancer diagnosis or scare, and other women do not get the test because of a lack of health insurance. These reasons are not great enough to prevent putting off a life-saving test. Mammograms are essential for women's health. Women 50 years and older that get mammograms every other year can reduce their chance of death by breast cancer by as much as 30%. Mammograms are not flawless and can induce unwanted anxiety in a patient. Mammograms carry a high risk of false positives. When a woman does receive a false positive, this usually means unnecessary worry, testing, biopsies, and trips to the doctor that only causes stress and concern just to find out that they don't have cancer. Short-term psychological stress consequences have been shown to occur among women that receive false positives in mammography screenings. Psychological distress may only have short-term consequences, but worry about breast cancer will likely last longer than a couple of months. Distress can be measured in many ways among women that receive the false positive results. Anxiety, thoughts about cancer beliefs, depression, worry, and thoughts about early detection are all forms of distress that women experience when they receive a false positive result. False positive results can leave women with a greater perception of a higher breast cancer risk. These results can also leave women with thoughts about breast cancer as a more severe disease. A study was done on 385 Dutch women that had received abnormal mammogram results. 233 women had false positive results, while 152 were actually diagnosed with cancer. An interesting finding in the study was that the patients that received a false positive reading were younger than the patients that were found to have cancer. The patients that received the false positive results had to go for more post-screening procedures. 14% of the patients that actually had cancer had to go for post-screening diagnostic procedures, while 32% of the patients that received the false positive results went for post-screening procedures. About 55% of the patients that received the false positive results had to go back for additional testing. Some people had to go back as many as 8 times after the initial screening. These patients had higher levels of anxiety because they had to go back for so much additional testing and screenings. For whatever reason, women that received false positive results had more anxiety than the patients that were actually diagnosed with breast cancer. These statistics would be troubling for any woman that is considering going for a mammogram screening. Women are reluctant to go for mammogram screenings for many reasons, the primary reason being that they are worried that an abnormality will be found and that they will receive false positive results. These results come with unnecessary stress and anxiety for the patients. Many patients do not want to have to deal with this and are therefore reluctant to get mammograms.